A year ago, or even a month ago, the daily COVID infection number might have seemed impossible. Roughly 870,000 cases recorded Friday alone.
This has now been the largest influx of patients that we've ever taken care of. They've been the sickest of the patients we've ever taken care of.
A deeper dive into the number of hospitalized patients and deaths reveals trends that certainly don't match the massive case rise daily average. A 265% increase over 2 weeks compared to a 72% increase for hospitalizations, while deaths have shown little change at about 1,500 a day.
Are you worried that we could see a dramatic rise in the amount of people dying from COVID in the near future?
It's always possible. And I think it really depends upon who gets infected in the next several days and weeks.
The emerging portrait of Omicron is a variant increasingly making people sick. At the moment, a daily average of nearly 122,000 people are hospitalized with the virus. Not far from the country's all-time high of 137,000 in January of last year, with health experts predicting that record could fall in days. At the same time, hospitals nationwide are reporting a dwindling number of available staff.
Every hospital is struggling with a staffing shortage like they've never experienced. Now, because of staff being out due to COVID, it's just a gasoline can on the fire.
I'm here to tell you, we're tired, we're exhausted, and we're literally on the edge.
Of those in American ICUs right now, just under 32% of adults are being treated for the virus. The other 2/3 are not. That's a notch below where we were during the peak of Delta, when 38% of ICU patients had COVID, but it's also significantly higher than we were just a month ago. There's also a new development in some major cities, like New York and Miami, where roughly half the people admitted for care are being treated for something other than COVID and then testing positive.
We are now admitting patients who have incidental infections who might be earlier in their disease and who are more contagious. We are seeing people showing up and finding out that they also have coronavirus in addition to the reason that they're there.
Yet admitted for COVID-19 or not, doctors say there is a common thread.
Most of the patients who are admitted to the hospital are unvaccinated. For those who are being admitted to the hospital who are vaccinated, their severity of illness is less.
Across New York State, 40 hospitals have tipped the threshold for delaying non-urgent surgeries as the nation grapples with the still rising flood of patients.
And Sam joins us now from outside Miami's Jackson Memorial. Sam, how worried are officials about ICU capacity?
Jose, they're pretty worried. We just tonight topped 80% capacity in our ICUs nationally. Doctors tell me once you get into the 85 to 90% range, lives will be lost that could have been saved because of a lack of resources. Jose?
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.